Order. Order. Questions to the Secretary of State for Health and Social Care, Mr. Peter Kyle.
Good morning, Mr. Speaker. Question number 1, please.
Secretary of State for Health and Social Care, Secretary Matt Hancock.
Mr. Speaker, on the 30th of January, we announced that we're going to increase access to PrEP, doubling the number of people who can receive this potentially life-saving HIV prevention drug.
Peter Kyle.
But funding for HIV prevention has become quite complex, with a complex mix of central funding and local authority funding, and cities like Brighton and Hove still have the highest contraction rates outside of London. Will the Secretary of State meet with me and THT to understand how this is impacting us in the front line and what can be done more?
Yes, of course, I'd be delighted to meet with him to discuss this. In the long-term plan, we made clear that we're looking at commissioning arrangements for sexual health services. I'm delighted that the number of new cases of HIV have been falling, and we've been able to declare that by 2030 we want the UK to be have zero AIDS. Now, that is an achievable goal, but a hard one. I'll work with anybody to make it happen.
Dr. Sarah Wollaston.
Does the Secretary of State, though, share the widespread concern about the variation in availability of PrEP treatment, which is surely an unacceptable situation?
There is a variability in availability. Of course, the current model of delivery is a trial, and we've doubled the size of that trial, but it's still a trial that runs until 2021. But I'm very happy to work with her, as well as the honourable gentleman opposite, to try to make sure this is as available as possible.
Slaughter.
Hammersmith is one of the sites which is now closed. When is PrEP going to be made freely available? Here we have a drug which has almost 100% effectiveness, which will save the NHS money through HIV infection protection. When are we actually going to see it available to anybody who needs it?
Well, as I've said, last month we doubled the availability of PrEP, which is an important step in the right direction.
Will Quince.
Thank you, Mr. Speaker. Colchester is one of the sites that is now closed to men who have sex with men who want to access the HIV prevention drug PrEP. When will the government's commitment, made almost 3 weeks ago, to double the number of places on the PrEP trial be implemented across all trial sites?
Well, it is being implemented as we speak, and I'm very happy to talk to him about when it will be rolled out in Colchester.
Thank you, Mr. Speaker. I welcome the government's commitment to end the transmission of HIV in England by 2030. However, HIV reduction wasn't mentioned in either the prevention plan or the long-term plan. So how will the government reach this ambitious goal without a concerted and fully costed strategy?
Well, we do have a concerted and fully costed strategy. Indeed, I've given the commitment of ending new AIDS cases by 2030 with a plan around that. And the long-term plan goes into detail about about new ways of commissioning sexual health services. So this is a very important area. As she says, it's an important part of the prevention agenda, and we're going to make sure we get it right.